that's going to begin the dialogue. So thank you for that question, Ryan. Next question.
Comes from the line of Jim Roop with Westwood One News. Please go ahead. Your line is open.
Thank you very much. Good afternoon. I was wondering, and maybe both Supervisor Barger and Dr. Ferrer could maybe answer this question, but it seems as though some of the issues with the institutional settings, nursing homes, long care facilities, seems to be in the comings and goings of the LVNs that work there. A number of LVNs work at a number of places. A lot of places will not hire LVNs full-time and give them benefits, so to make an income, to make a career, many of them have to work in a few different places. So it seems a little, I don't know, disconnected to prohibit families from visiting their loved ones in these facilities, yet allow LVNs to come and go, maybe from different facilities, maybe even from a hospital, 2 or 3 of those. It just doesn't seem to make a whole lot of sense for that. Do you envision a revamping of this institution to maybe require more of assigning to patients and the hiring full-time of LVNs as opposed to allowing this to happen? Because this seems to be a lot of how the spread may be occurring.
So I'm going to let Dr. Ferrer answer part of that question, but I will say that is why I'm working with Dr. Galley, who's here as well, to address the asymptomatic component of testing and recognize that the LVNs are a vital component to operating these skilled nursing facilities. We need to get the testing out there, and we need to get out there as soon as possible because they are coming in and out and taking care of those residents. As you know, in Pasadena, they had to call in the California National Guard to help support because they were having a difficult time getting people to come in and work there. So we are sensitive to the fact that the line workers need to be tested first and foremost. As it relates to family members that are coming in, again, the workers are coming in to work. Family members, I understand the frustration with not being able to see your loved one, but it's being done as
Claudia Pisciuta with KNX News Radio. Please go ahead.
Hey, as usual, I have a few questions. So, Barbara, I'm wondering if, given everything that you know at this point, do you think that people should be housed in motel or hotel rooms rather than rec centers or other shelters where many people, while separated, are sharing one large space, bathrooms, and other facilities? Number 2, do you have more details on testing plans for skilled nursing and other long-term care facilities? Will it be offered monthly? How many people are we potentially talking about? And is there the capacity to do that? And if not, at what point might we have that capacity? Third question, given the questions that are being raised about the 6-foot distancing, do you think it's time to reevaluate that? Thank you.
So I'm going to let Dr. Galley address the testing component questions that you had, and then Dr. Ferrer can follow up, or if Dr. Galley can answer both, that'd be great.
Hi, so I'll address your questions on the plans for testing capacity in the SNF. It's a great question. So the first priority is obviously to test in outbreak facilities. So that would include testing both the individuals who have symptoms as well as all of the staff and residents in those sites who may not be symptomatic. We need to make sure that they haven't been exposed and aren't asymptomatic carriers of the virus. That would include surveillance testing period of time. Probably on a weekly basis, though that remains to be determined until the outbreak is deemed to be closed and over. The second priority is to start surveillance testing of SNFs that don't have an active outbreak. So again, the exact frequency of that at an optimal rate might be weekly, but it will depend in part on the availability of the supply chain to provide adequate number of test kits to move in that direction. I'll turn it over to Dr. Ferrer for the next part of this question.
Yeah, thanks, Claudia. I appreciate the question on shelters, and I know that there's very smart people who look at this issue somewhat differently. I think from our perspective, we need to have multiple strategies for making sure that people who are experiencing homelessness have the services and support that they need. Obviously, for those who are most medically fragile, hotels and motels make the most sense, where they'll have the least exposure to other people and can really, frankly, quarantine themselves during the pandemic. I think for others who are currently living in encampments or in tents on our streets, if they want to come in and have a place where they have social support, where they have easier access to medical services, healthcare services, where they have access every day to food and to bathrooms, the recreational centers that have opened are essential. And I would never want to choose for a person experiencing homelessness whether or not they need to be on the streets or in a place that has services. I think that's a choice that we're offering for people who are experiencing homelessness. I, for one, think it's the right thing to do. I think we can work in our shelter settings to make them as safe as we possibly can, knowing that there's risk everywhere for spread of COVID-19. But in addition to the risks for COVID-19, the risks to living unsheltered are also significant. There are risks to people's health. There's risk for other infections. There's risk for violence. So I appreciate that this county has done everything they can to offer more alternatives now during the pandemic, recognizing that there are many homeless people that need basic services during the pandemic, and the shelters are, in fact, a place where they can get many of those services. So thanks for that question.
So the update from LA County today, again, 29 additional deaths. So a total of 942 people, 900 new cases to report. This is KNX In Depth. I'm Mike Simpson.
And I'm Charles Feldman. Hope you all had a good weekend. We are entering clearly into the third month of sheltering in place. And if you are losing your mind over all of this, at least a little, you're not alone. Researchers are starting to see more and more people breaking the quarantine rules to venture out. You saw the evidence this weekend, the beaches in Orange County. So can we hang on for a few more weeks to flatten the coronavirus curve? We will go in depth. And what do they know in Sweden that we do not? We will go to Stockholm, where they are skipping the economic lockdown. Their argument that their results on coronavirus infections in the end will be the same as everyone else.
Coronavirus antibodies, which could provide us with immunity once we've already been infected, may not be all they've been promised to be, or they might. The thing is, we're not sure. So we'll look at some new research from the World Health Organization. Strange, scary, inexplicable symptoms, even more of them now showing up in young COVID patients. We'll talk about that. And could a common over-the-counter heartburn medication be a secret weapon against all this?
I hope so. We start with
Fingers crossed.
yeah. We start with quarantine fatigue. Matt Eisman is a stand-up comic, host of American Ninja Warrior, but before he got into comedy, he was a medical doctor. So, Matt, did you look at your own bills? Is that how you became a comedian? What happened?
That's pretty much it. I'll tell you who it wasn't funny to was my parents when I left medicine to start doing comedy. But I will, in a very selfish way, I will tell you right now, I am very glad not to be in the hospital, because I just look at what our frontline care workers are doing, and a lot of my friends and colleagues from medical school, they're literally placing their lives in the line, and so I have such an appreciation for them. While selfishly, I get to sit at home and watch The Last Dance and just worry about getting a little stir crazy is my biggest issue.
Well, let's talk about getting stir crazy. We talked about the beaches. We saw the pictures from the beaches. You think we've made it this far, and it's getting a little tough for people? They're starting to fray at the edges, and they're creeping outside.
Of course it is. And the reality is Newport Beach was open. And, when I looked at that story, the one thing I will say was, while it was very concerning, when I did see, I saw a helicopter view, and the one thing I did notice, it did seem as though there were groups together, but very likely those could have been people who were quarantining together, and I hope that was the case. But otherwise, it looked like people were trying to maintain the distance. So even though when I initially heard that, I thought, my God, what are people doing? I do believe the messaging is still sinking into people. And even as they're testing the limits, and as the limits are being allowed to be tested, again, that beach was open, I think this message has gotten through. And I think, as someone obviously who was in medical school and looking at the public health issue, my dad's a doctor and was an expert on tuberculosis and that what an infectious disease challenge that was. And you see the challenge of educating people and getting buy-in. And this has been not just an effort in the state or in the nation, but a worldwide effort that certainly in my lifetime I've never seen people coming together in terms of education and in terms of compliance. And we often focus on the people who are violating it. And look, I just went for a walk, and when I see someone without a mask, I'll admit, I'm like, how dare you? How dare you walk out here without a mask? Even though, the studies do show that outdoors with distances, sunlight is a great disinfectant. But what I love is it's been remarkable to see the education and the buy-in that we've gotten.
So, Matt, you're probably uniquely qualified to answer this question as a former doctor, now stand-up comic. As serious as this situation is, and it clearly is serious, and it is in many ways far from a laughing matter. Nonetheless, how can people keep a certain amount of sense of humor about this? Because otherwise, none of us are going to get through this.
Well, they talked about the term social distancing, and a lot of people said what an actually incorrect term, physical distancing, but being connected. And for me, my God, I would say the amount of Tiger King. How many of us have become aware of Joe Exotic right now? What a shared cultural experience this has been of this esoteric tiger trader who's captured his imagination. And I think what we're seeing is it's been a sense of slowing down and finding the humor in this, reaching out to friends. Look, my friends and I, we're playing poker once or twice a week together, where we get on Zoom, we have an app, and we have a couple beers, and we talk trash to each other. And it's like we're back in college again. And I think for me, this has been, I've tried to find the silver linings.
Yeah, at least we have virtual happy hour, right?
Virtual happy hour, but it really is a time of connecting, and with Zoom and FaceTime, I think realizing how busy we made ourselves, particularly with the phone, where you feel this constant sense of urgency, and this forced slowing down, I think, has been something that I hope a lot of people are trying to see if you can, to take advantage of this time. And and find some new routines. But look, I get it. For so many people are facing this unknown and not knowing when we're going to be going back to normal, not knowing when they're going to go back to work or if they'll have a job to go back to, not knowing how bills are going to be met. So the stresses right now are real. So finding that humor, and whether it's watching American Ninja Warrior, a lot of Netflix comedy specials, a lot of podcasts, there's a lot of content out there. And I think finding those things that give you that comfort, that give you that sense of normalcy. My God, we all want to feel a little bit of routine and a little bit of normalcy right now in what is an unprecedented time.
I never realized before this that not only how many good things are on Netflix, but how many really bad things are on Netflix.
And yet how much we still watch the bad things.
Yeah, I know.
This is terrible.
I'll give it one more episode. Maybe it'll get better. Yeah.
Oh, I love hate watching something where like, this is so bad, I have to call a friend and make them watch with me so we can complain about it.
Matt Eisman, stand-up comic, host of American Ninja Warrior. Before that, he was a doctor.
Okay, the KNX In-Depth podcast available, as always, for free. Download the radio.com app onto your smartphone. Mike and I also, every day, do a podcast. It's called Coronavirus Daily, World on Pause. Not on pause is KNX In-Depth, because when we come back, Sweden, the country, isn't bothering with shelter-in-place rules, and it is betting that its coronavirus numbers will look exactly the same as those countries that did lock down.
This is Chris, Jack, and Audrey Dolan of the Dolan Law Firm.
Hey, everybody. Hey, Dad, what makes you think that you can say you're the best personal injury law firm?
Well, Audrey, the Dolan Law Firm has been designated as the best personal injury law firm in San Francisco by the Examiner and the Weekly, amongst the best personal injury law firms in the nation by U.S. News & World Report, and I was chosen as one of the top personal injury lawyers in all of California by the Daily Journal. I can say confidently, the Dolan Law Firm, we're the best lawyers we hope you'll never need. DolanLawFirm.com.
Doctor's Log, Hell Date 2020. Right now, health and medical industries are feeling the pressure of the COVID-19 outbreak. Doctors are feeling that pressure. Nurses are feeling that pressure. I'm definitely feeling that pressure. And so I wanted to capture some of this journey. It's a log of this scary adventure we're all on together. I'm Esther Chu, MD, and this is my Doctor's Log. Go subscribe on radio.com and wherever you get your podcasts.
Let's say you just bought a house. Bad news is, you're one step closer to becoming your parents. You'll proudly mow the lawn. Ask if anybody noticed you mowed the lawn. Tell people to stay off the lawn. Compare it to your neighbor's lawn. And complain about having to mow the lawn again. Good news is, it's easy to bundle home and auto through Progressive and save on your car insurance, which, of course, will go right into the lawn. Progressive Casualty Insurance Company, affiliates, and other insurers. Discount not available in all states or situations.
Boy, things have gotten really weird.
Yeah, it almost seems like every day you don't know what to expect. So we are going to try and help get you through it.
I'm Charles Feldman.
And I'm Mike Simpson, and we're the hosts of the new podcast, Coronavirus Daily. We bring in some of the top experts all around the world to ask the questions that you have.
Because we are all in this together, and you know what? We are all going to survive this together.
Again, Coronavirus Daily on the radio.com app, Apple Podcasts, Google Podcasts, and Stitcher.
Doctor's Log, Hell Date 2020. Right now, health and medical industries are feeling the pressure of the COVID-19 outbreak. Doctors are feeling that pressure. Nurses are feeling that pressure. I'm definitely feeling that pressure. And so I wanted to capture some of this journey. It's a log of this scary adventure we're all on together. I'm Esther Chu, MD, and this is my Doctor's Log. Go subscribe on radio.com and wherever you get your podcasts.
It's 1:45. Traffic every 10 minutes on the 5s are brought to you by Norm Reeves Honda. Here's Tom Tran.
Got a pretty big problem up in the Bakersfield area. A section of the 58 got shut down for several hours because of a hazmat situation. A truck flipped over with several batteries, lots of batteries actually. That had both sides of the 58 closed for a while. They've reopened the westbound lanes, but the eastbound side still closed from Oswell over toward Wapachete Highway. Let's check in with Brian Douglas. taking a look at the 405.
Where we've got some road work. This has been going on now for the past couple of weeks. At a perfect time to do this as well. Northbound 405 through Seal Beach, 2 right lanes blocked. A little bit of a delay off that 22. Your southbound side through Fountain Valley, you've got 2 carpool lanes blocked. And even northbound, as you leave Costa Mesa, heading into Fountain Valley, right about Euclid, you'll see some left lanes blocked here as well. Tom?
If you need your vehicle serviced, the Norm Reeves Honda Superstore is open and ready to serve you. Visit us in Huntington Beach, West Covina, or Irvine Auto Center in the Cerritos Auto Square. Schedule service online at normreeves.com. Your next report, 155. More traffic reports more often. Tom Pran, KNX 1070 News Radio.
You're listening to KNX In Depth with Mike Simpson. I'm Charles Feldman.
Reminder, coming up in the next hour, some patients in their 30s and 40s suffering from massive strokes, unexpected, particularly scary symptom from the virus. And could a common over-the-counter heartburn medication be a secret weapon in fighting COVID-19? We'll take a look at that.
Right now, though, Sweden has not been immune to the coronavirus outbreak, and yet Sweden has not shut down restaurants, stores, bars, or theaters. Yes, they are encouraging social distancing, but have not come anywhere close to the extreme quarantine rules that we are all experiencing here. So what do the Swedes know that we do not? Dr. Johan G. Jesse is an epidemiologist, advisor to Sweden's Ministry of Health and Social Affairs, as well as the former chief scientist of the European Center for Disease Control. So there are no forced closures in Sweden right now at all?
There are very few restrictions in Sweden, and they are not backed up by law. We have this assumption that people are not stupid. So if you tell them what they should not be doing, they usually refrain from doing that. There are a few restrictions. Schools are closed from age 16 and up, and universities. There are some rules about restaurants, how they serve the food and how close the tables should be to one another. A crowd cannot be bigger than 50 people, and domestic traveling there's no law, nothing, but people are asked not to travel unnecessary inside Sweden. So these are the basic things.
Is the notion that if you had stricter guidelines or even laws about this, people would probably find ways around them anyway?
Could very well be, yes.
In terms of caseload and deaths, how do you compare to your neighbors? And do the neighbors have tougher restrictions than you guys do?
Yes. We've got 3 neighboring countries. That's Denmark, Norway, and Finland, and they all have lower figures than we have, and they have much stronger restrictions. But what I keep saying, and the number of dead in Stockholm, or in Sweden, is around 2,200 for a population of 10 million. That's more than our neighboring countries. But I keep saying that before you start counting the deaths, wait till this epidemic is over, because the countries that are very low now will catch up when they loosen the restriction.
So is that the idea that at the end of the day, say a year from now or whatever time period one wants to put on this, that if you compare the death figures from countries that have more strict lockdown guidelines as opposed to the looser ones in Sweden, that in the end it's a wash, that everybody kind of comes out the same?
Approximately, yes. Because this is an epidemic that we can do nothing to stop about. It's spreading by its own force, and we can't stop it.
Now, was this the approach from the get-go, or was there debate over this? Were there some that wanted to make a model more like other countries, maybe like ours? And some of our restrictions are lifting, but they're stricter than yours.
They're stricter. There's one interesting finding I made today, and that is that 3 countries in Europe that have very strict lockdown. That's the UK, it's Ireland, and it's Belgium. All have higher death rates than Sweden, actually. Our neighboring countries have lower, but the UK, Ireland, and Belgium are higher.
So, but in some ways, I suppose it's and forgive me to phrase it this way, but it's almost maybe it's realistic, but it's almost a very pessimistic evaluation, isn't it? In other words, there's nothing we can do about it, so we may as well go about life as normal anyway, because some of us are going to live and some of us are going to die.
Yeah, I think you should still protect the old and frail people. But the way we're finding more and more now is that this disease, this infection, spreads across the globe. Around 98.5% of the people will have a very light infection. Most will don't even know that they have it. a small fraction will be sick, and an even smaller fraction will die. But basically, it's a mild disease that's spreading much quicker than we realize, and that is much more infectious than we realize. And there's not so much you can do about it.
Do we know what people think of this in Sweden? I mean, does the population approve of this approach, or do they think, no, more needs to be done? And you go back to that, we got to flatten the curve idea so your hospitals don't get overwhelmed.
Well, the hospitals are. The curves are bending down, and the hospitals have not. They've worked hard. People in the hospital, admirable, but the curve is going down, and the hospitals have not been stretched yet.
And in Sweden, is the most the demographic of the most vulnerable population, is it similar to what it is in most of the rest of the world? Are there differences?
No, I think one difference is that multi-generation families are quite unusual. It's unusual that your granny lives with you. The granny would rather be in an institution in this country. So that's a thing that will affect the spread of the disease.
And is the age? What's the age of most vulnerability in Sweden?
Above 80. It's like any other country.
Have most people played by the rules, or what's the weather like there? Has it gotten warmer and people started to go out more, or have people been pretty good about this, not getting in big groups?
They have been pretty good, but last week was very warm actually, and then there were some crowds forming, and there's now the restaurants are open generally, but most of them are closed because they don't have any customers. But a few restaurants were actually closed by the medical officer of health yesterday, because the tables were too close and people were standing up at the bar and things like that.
You've been a doctor for a very long time. Have you seen other diseases? Is it common for some viral diseases to have such a wide variance in the way it's displayed? Most people being, as you mentioned, either asymptomatic or mildly symptomatic, and yet some people die from it.
Yes, SARS wasn't that rather the same. The SARS 17 years ago was about the same, actually.
Was there an economic reasoning in terms of doing what you're doing? Was that thought of during the debate? If we don't close everything down right now, we will have a speedier recovery on the other side? Or was it just back to the fact that you were mentioning earlier, from your point of view, that this is going to happen anyways to everybody, so we just gotta tough it out?
Mm-hmm. No, economists played very little role in this. One thing was not closing the schools. That one reason for that was not to destroy the labor force completely, because very few are housewives in this country, usually most in a couple both work. Children between 0 and 10 need someone to look after them, and if you close the schools, someone, usually the mother, will have to stay at home. And we lose half our healthcare staff in the country if that happens.
You mentioned most vulnerable as 80 and above, yet in a lot of countries like the U.S., they're using 60, 55, 65. Is that wrong?
Does it matter? In what way does it matter?
Well, it matters in which population you choose to be the most protective.
Oh, I see what you mean. Sorry. No, I think officially it's 70 and above. But if you look at deaths, it's almost, you have to be 80 to die almost.
And the rules for 70 and above where you are is what? Just don't go out, no trips to the store, or gloves and masks, and be as careful as you can?
No masks, we don't think they work. And you can go out, but if you're in that age group, you should be a bit careful. For example, I haven't seen my grandchildren inside. I've seen them outside because the infection doesn't spread outside. I've seen my grandchildren for the last month or so.
So I guess the bottom line is, do you think that countries that are doing much more stringent lockdown scenarios, are they overreacting?
Yes, and they are pushing their cases in front of them. So when they lift the restrictions, they will have the deaths.
So it's just a delayed reaction then on the back end?
Yes. On the back end, it's a delay.
Well,
delay.
But wait a minute. But isn't part of the idea of delaying it that besides keeping the population down in hospitals and in intensive care units, isn't the other idea that as more time goes by, perhaps, if not a vaccine, there'll be some proven therapies?
Yes, but that will have to come pretty quick then, because this epidemic won't last for long. And there are some experimental drugs, but before they're approved by FDA and before the factories can start cleaning them, will take some time. And as for the vaccine, we all know that will take a long time.
Dr. Johan Giesecke with his view from Sweden.
And when KNX In Depth continues, what if in the end it turns out that there is no immunity to this novel coronavirus, even among people who have already been infected?
We'll get you that after 2 o'clock. Right now, brought to you by First 5 California. We'll check traffic. Here's Tom Tran.
Got a couple of problems all on the 405. We'll start on the southbound side near Nordhoff. A camper's blocking the carpool lane. CHP's got to run a break, and they are reporting that traffic is coming in hot. So be careful on that South 405 up in the North Hills area. Let's check in with Brian Douglas, who's taking a look at the 405 in Orange County.
We've got Caltrans OC working on the 405 through Fountain Valley northbound. You've got the 2 left lanes blocked, carpool left, starting right about Euclid. So I do see a little bit of a delay there as you squeeze by. And up ahead, still 2 right lanes blocked through Seal Beach on that North 405. Some delays, especially coming off that 22. Tom?
Eastbound side of the 105, I see a little bit of slowing from Garfield over towards Downey Avenue. Shakes free by the time you get over towards Lakewood Boulevard. Learning in 2 languages is a great thing. While you're home together, play children's music in different languages. Catchy songs played over and over again can help kids learn and understand new words and concepts. More at first5california.com. Your next report, 205. More traffic reports more often. Tom Tran, KNX 1070 News Radio.
This is Chris, Jack, and Audrey Dolan of the Dolan Law Firm.
Hey, everybody. Hey, Dad, what makes you think that you can say you're the best personal injury law firm?
Well, Audrey, the Dolan Law Firm has been designated as the best personal injury law firm in San Francisco by the Examiner and the Weekly, amongst the best personal injury law firms in the nation by U.S. News and World Report, and I was chosen as one of the top personal injury lawyers in all of California by the Daily Journal. I can say confidently, the Dolan Law Firm, we're the best lawyers we hope you'll never need. DolanLawFirm.com.
Let's talk about protecting the clean air inside your home, which is important these days, right? Mike here for IQ Air. This company has a mission: clean air wherever possible, pure air wherever possible. And they have the affordable Autumn Series 5-in-1 personal air purifying system to make that happen for you. This is their #1 rated purifier that they have, delivers instant clean air free from 99% of airborne pollutants using exclusive filtering technology to take out airborne particles down to 0.003 microns. That's the smallest that exist. Swiss design, German made. So what you're getting is state-of-the-art equipment and a high-quality product. It's the cleanest air possible to directly wherever you're spending your time, to where you are breathing. You can set it up on any flat surface, your coffee table or maybe your nightstand, your desk. Again, if you're there, the air there is clean with you. Keep the air you breathe safe, that your family breathes safe right now. Visit iqair.com/US. Order your Autumn Series 5-in-1 personal purifier. It's ATEM, the Autumn. It's only at that website, iqair.com/US. iqair.com/US.
The DrinkWorks Home Bar by Keurig is the perfect Mother's Day gift. With over 24 cocktails at the push of a button, give Mom what she really wants at drinkworks.com/mom. From mojitos to mules to margaritas and the new brunch collection, the DrinkWorks Home Bar Mother's Day price is only $1.99 and available with delivery. Visit drinkworks.com/mom to save over $100 on the perfect Mother's Day gift. The DrinkWorks Home Bar by Keurig. Keurig is registered trademark of Keurig Green Mountain Inc. Used under license. Please enjoy responsibly.
This moment of gratitude is brought to you by Rocket Mortgage and the Rock family of companies.
We really want to thank my wife's cousin Marie, who works so hard as a nurse saving others.
To those who leave their homes to keep us safe in ours, thank you.
And yeah, you guys are awesome. We're sending all our love, gratitude, and hope your way.
Thank you. If you'd like to thank America's frontline and essential workers, visit everyoneknowsahero.com. Quicken Loans, LLC, NMLS number 3030, licensed in 50 states. Each legal entity that identifies themselves as part of the Rock family of companies are separate legal entities with their own governance and management structures.
Southern California's only 24-hour local news and traffic station. KNX, KRTH FM HD2 Los Angeles. KNX 1070 News Radio. A radio.com station. Depend on us.
This is Southern California's only 24-hour local news and traffic station, KNX 1070 News Radio. I'm Chris Sedens in the KNX 1070 newsroom. It's 2 o'clock. Back to KNX In Depth in just a moment. But first, in-depth team coverage of the coronavirus pandemic. And Governor Newsom says he's not happy with the pictures he saw of the crowded Orange County beaches and Ventura County beaches over the weekend. In his daily coronavirus briefing, he, of course, it was carried live here on KNX. He said he was hoping to loosen some of California's stay-at-home orders in the next few weeks, but he might have to rethink that now.
The only thing that will set us back is people stopping to practice physical distancing and appropriate appropriate social distancing. That's the only thing that's going to slow down our ability to reopen this economy. Our ability to adapt and modify this stay-at-home order. As I said, weeks, not months. If the data continues to be as stable as it has been,
to determine that? Do you have to follow people who are infected with what is, after all, a new virus for a couple of years to see what happens in the real world?
That is one way that I'm sure it will be done. So many of these recovered patients will be monitored over time to see what their antibody titers or levels in their blood are, and to see how well those antibodies work at neutralizing the virus in the lab. Another way, though, that we might have some indication about how well antibodies protect is through the use of these convalescent plasma therapy trials that are ongoing at a number of medical centers around the country and in New York. Those basically use the antibodies from recovered COVID patients to treat current COVID patients. So if those are effective, that's a pretty good indication that those antibodies are in fact protective.
What do you make of these cases or stories right now of people getting reinfected? Is this still a mystery? Are these still anecdotal cases? Or you've been following any, or we just don't know yet?
I have been following it, and there hasn't really been a great paper out about this. However, a statement from the South Korean CDC recently said that those patients were testing positive for the genetic material of the virus, but it appeared that they were not actually reinfected with infectious virus, meaning that they still had little parts of the virus sticking around, but those parts are not infectious, and those parts are not likely to result in transmission to people and causing new cases.
Is it known whether this virus hides out in the human body, that you could be infected and then seemingly be cleared of it, and then it emerges in some other disease form later on?
That's certainly possible, and we have not ruled that out. Certainly, we've seen that with other emerging viruses. In Ebola, for example, we discovered after the West African outbreak that Ebola survivors could carry virus in their testes and transmit it sexually long after they had recovered. However, we don't have any indication that anything like that is going on with the coronavirus yet.
Why do you think this tweet or statement went out? Is it because there was so much discussion last week about maybe countries issuing these immunity passports, and that would be a way to get people back to work? And this was the WHO at least trying to be like, okay, don't drop immunity passports yet and give them to people and start sending them out. We got to wait a little while.
I think that is exactly what happened. I think that the World Health Organization and myself and many others in virology are concerned about the idea of immunity certificates just because we don't know enough about immunity to start telling people that, yeah, you've got a clean bill of health, go ahead and get back out there and resume your normal life. We don't really know what the risk of that is, so I think they were just trying to be very, very careful.
Are there viral infections that do produce antibodies, but the antibodies are not protective at all?
That can happen. That can happen for a variety of different viruses. Also, there are some cases such as dengue virus where there are 4 different kinds of dengue virus. And if you get infected with one, you will be protected against that one, but not some of the other kinds. Even though the antibodies will still recognize those other kinds of dengue virus, you can actually still get infected with them. So we just really don't know if anything like that is going on with coronavirus. As I mentioned, the preliminary data is encouraging. It does appear that most patients do develop these IgG neutralizing antibodies and that those antibodies are capable of neutralizing the virus in the lab.
How long do you usually get, or what would you suspect in terms of immunity we could get with this if we get it? Is it like you're clear for 3 or 6 months, maybe a year? But if this is going around every season and eventually we're getting coronavirus vaccines every year, it's because, you're not good for a lifetime.
So that to me is really unclear, and that unfortunately is one of the questions that we really can't figure out any other way than by following people for a long period of time and seeing how long their immunity lasts. Certainly people have suggested that the immunity might not be lifelong protection because the other common cold coronaviruses don't offer that, but we really honestly don't know very much about coronavirus immunity in general and how long it lasts over time. So we really need to just do the experiments and wait the time that it's going to take to follow all those patients to find out.
Is there such variance in the amount of time one is immune to a coronavirus infection because do they mutate at a quicker rate?
Actually, coronaviruses mutate at a slower rate.
Okay.
Than many other RNA viruses, and that's important. So our genomes are DNA. Herpes viruses, pox viruses, there are a number of other DNA viruses that have a mutation rate that's very similar to ours. RNA viruses have a much faster mutation rate because the enzyme that copies the genome doesn't have the ability to correct mistakes. Coronaviruses have an RNA genome, and so they don't correct mistakes, but they actually have another special enzyme that does some partial corrections when they're replicating. So they have a slower mutation rate than other RNA viruses like flu or Ebola, but a higher mutation rate than a DNA virus or a DNA genome like us. So that means that it is less likely than other RNA viruses to have new strains or immunologically distinct variants coming from it.
Dr. Angela Rasmussen, virologist at the Center for Infection and Immunity at Columbia University.
Now, some coronavirus patients in their 30s and 40s who are not exhibiting the strong symptoms are nonetheless being struck by massive strokes, which is a strong symptom in and of itself.
And so you are aware, we are waiting for the president to make remarks from the White House. This is billed as some sort of testing announcement as more states move towards opening portions of their economies. So when he gets there, we will bring it to you live. And actually, this just coming through, looks like that's delayed until at least 2:30 our time. So there's the latest, 2:30 for the president.
The DrinkWorks Home Bar by Keurig is the perfect Mother's Day gift with over 24 cocktails at the push of a button, including the new brunch collection. Give mom what she really wants at drinkworks.com/mom. The brunch collection includes mimosa, peach Bellini, rise and shine margarita, and a midday martini. Save over $100 on the perfect Mother's Day gift. The DrinkWorks Home Bar by Keurig is only $1.99 at drinkworks.com/mom. Keurig is registered trademark of Keurig Green Mountain Inc. Used under license. Please enjoy responsibly.
This is Chris, Jack, and Audrey Dolan of the Dolan Law Firm.
Hey, everybody. Hey, Dad, what makes you think that you can say you're the best personal injury law firm?
Well, Audrey, the Dolan Law Firm has been designated as the best personal injury law firm in San Francisco by the Examiner and the Weekly, amongst the best personal injury law firms in the nation by U.S. News and World Report, and I was chosen as one of the top personal injury lawyers in all of California by the Daily Journal. I can say confidently, the Dolan Law Firm, we're the best lawyers we hope you'll never need. DolanLawFirm.com.
Hi, it's Jamie, Progressive's #1, #2 employee. Leave a message at the... Hi, Jamie. It's you, Jamie. Don't hang up. You need to hear this. You gotta quit wearing that aviator jacket. Nobody's buying it. I'm sorry you have to hear it from me, but at Progressive, we're all about giving it to people straight. That's why we show our rates alongside our competitors' rates. And when you're helping people find great rates, you don't need some jacket to look cool. Just keep rocking that scarf.
Progressive Casualty Insurance Company and affiliates. Comparisons not available in all states or situations. Prices vary based on how you buy.
Life has changed almost overnight.
Yeah, you have a lot of questions. We are going to try to get you some answers. I'm Mike Simpson.
And I'm Charles Feldman. Together, we host Coronavirus Daily, a podcast designed to help us all get through this crisis together.
We go around the world and talk to some of the top experts out there. So think of this as a guide for you and your family. Multiple ways to listen: radio.com, the radio.com app, Apple Podcasts, Google Podcasts, and Stitcher.
Remember, that's Coronavirus Daily.
So you just tuned in. Did you miss something? Came in the middle of a sentence? Or a show? That's unfortunate. That's why there's radio.com Rewind. Talk about convenient. You can rewind this station up to 24 hours back. No matter what you missed, it's still there. Just go to the bottom of your screen and click the rewind button. Then pick the hour you want and you're instantly there. Listen to what you want when you want with radio.com Rewind. Radio.com Rewind. Woke up late and missed dialing into the professor's lecture? Not rewindable. Whatever. 20 minutes late dialing into the important conference call? Oops. Not rewindable. The station you're listening to now on radio.com? Very rewindable. Radio.com Rewind lets you rewind this station up to 24 hours back. You won't miss anything ever again. Or at least on radio.com. Just go to the bottom of your screen and click the rewind button. Listen to what you want when you want with radio.com Rewind. Did you know you can actually pause and rewind live radio? Yeah, that's a thing. It's radio.com Rewind. Here's how it works. If you're listening to this station and you miss something, it's easy to go back in time. Just go to the bottom of your screen and slide up the rewind banner. Scroll to the left to go back to previous hours. Just pick the purple card for the hour you want and press play. Simple. Pick any hour in the last 24. Make missing important news a distant memory. Listen to what you want when you want with radio.com Rewind.
This week in music. Sadly, falling in reverse guitarist Derek Jones has died at the age of 35. The Hella Mega Tour featuring Green Day, Fall Out Boy, and Weezer has officially been postponed until 2021. Fans can now buy a bat-biting themed Ozzy Osbourne shirt and face mask combo at his website. Now just sit back and wait for offended people to start posting. And Slipknot's Corey Taylor says he and his wife are launching a plant-based taco truck. And that's This Week in Music.
You're listening to KNX In Depth, along with Mike Simpson. I'm Charles Feldman.
So we told you last week about this phenomenon of blood clots, lots of them being found in the bodies of coronavirus patients. We are now hearing about those clots making their way to the brains of patients, with pretty horrifying results.
And these are younger people infected with coronavirus in their 30s and 40s, suffering from massive strokes and confounding doctors. Dr. Lewis Kaplan is a critical care surgeon specialist at the University of Pennsylvania and Philadelphia's VA Medical Center. Dr. Kaplan, thank you for joining us. This seems like a very strange type of symptom for something that initially we were all told was basically a respiratory virus that produced basically respiratory
This moment of gratitude is brought to you by Rocket Mortgage and the Rock family of companies.
We really want to thank my wife's cousin Marie, who works so hard as a nurse saving others.
To those who leave their homes to keep us safe in ours, thank you.
And yeah, you guys are awesome. We're sending all our love, gratitude, and hope your way.
Thank you. If you'd like to thank America's frontline and essential workers, visit everyoneknowsahero.com. Quicken Loans, LLC, NMLS number 3030, licensed in 50 states. Each legal entity that identifies themselves as part of the Rock family of companies are separate legal entities with their own governance and management structures.
Yeah, there's always an explanation for things. We are searching for it, but one of the very promising and prominent thoughts about this virus is that it does two really powerful things. One is that it triggers an immune response, and the younger you are, perhaps the more robust, the more powerful immune response you have. We have learned about this from other kinds of infections, and in fact, we have a name for it. It's an inflammatory cascade, but the catchier term is cytokine storm. It kind of describes all of the different molecules that activate your immune system. Some of those immune complexes are big, and they can get stuck in places. That helps us to understand some of the perhaps small blood vessels, the conjunctivitis, the inflammation in your eye, perhaps some of the changes in smell and taste, and perhaps what have been colorfully called COVID toes. But that doesn't tell us about the big blood vessels. We've learned something else. When you look at the people that are really sick that are on the breathing machines, and you look at the secretions inside those tubes, we normally would expect a few cells from the lining of your lung, some cells that respond to infection, inflammatory cells or white blood cells. We know about those. And a lot of mucus and debris that doesn't have a lot of cells in it. That's not what we're finding. We're finding lots of cells from the line